Well, good afternoon, everyone, and welcome to our monthly Lunch and Learn. My name is Caroline G., age-friendly community connector with the Edmonton Seniors Coordinating Council, and I'll be your host for today. This event is brought to you by Age Friendly Edmonton, and it's an initiative of the Edmonton Seniors Coordinating Council. Oops, just trying to advance my slides here. It's just not cooperating. Sorry. There we go. Sorry about that. I'll just start again here. This event is brought to you by Age Friendly Edmonton, and it is an initiative of the Edmonton Seniors Coordinating Council supported by the City of Edmonton. Age Friendly Edmonton is part of a global movement to build age-friendly cities and communities, and is a city that recognizes the diverse populations and needs of seniors and actively supports their inclusion, engagement, and well-being. We respectfully acknowledge that the Edmonton Seniors Coordinating Council is in Treaty 6 and on the traditional lands of the Cree, Blackfoot, Iroquois, Dene, Nakota, Métis, and Saulteaux, Anishinaabe, Ojibwe nations. We acknowledge and respect the past, present, and future generations of all First Nations, Inuit, and Métis people who continue to strengthen Edmonton and Canada. Now, I'd like to just to highlight a few housekeeping items for today. If you have comments or questions, as they come to mind, feel free to type them in the chat. We will do our very best to answer them at the end of the presentation as time allows. Please keep muted during the presentation. That would be greatly appreciated. As this presentation is also being recorded, you can view this later on the Edmonton Seniors Coordinating Council's YouTube channel. I will ask Megan to put the link in the chat for you. Now, let's get down to business. Our presenter today is Melanie Morgan-Redshaw. Melanie is the Education Coordinator with the Injury Prevention Center at the University of Alberta. She works with community partners in education, health, government, and other organizations, and helps to coordinate injury prevention initiatives for children, youth, and older adults, including today's presentation, Finding Balance Falls Prevention Program. Melanie has a Bachelor of Education and a Master's of Education, both from the University of Alberta. So I welcome Melanie and hand the following time to her. I will just stop sharing, and then Melanie also has a presentation. Too many M's.
Lots of M's, yes. So I just wanted to say thank you to Carolyn and Megan for inviting me today to join with you and to talk a little bit about falls prevention. So before I start my presentation, just a quick question for all of you. If you have your camera on, that's great. Put a thumbs up or a thumbs down. Yes is thumbs up. No is thumbs down. Is falling a normal part of aging? If you think it is a normal part of aging, thumbs up. If you think it is not a normal part of aging, thumbs down. So just going to give you a moment to think about it. I'm going to just start my screen and I will be talking about it in a minute. So here we go. Make sure I get the right screen. And here we go. Carolyn, are we good to go?
Yes.
All right. Super. Yeah. All right. Thank you so much. Okay. Sorry, just got to get everything. So in answer to the question of is falls a normal part of aging, and I'm just going to take off my video just to make sure that everything works with my computer. So we know that 1 in 3 older Albertans fall each year. That means that there are people who over 65 who are not falling. So it means that falling is not inevitable and that there must be factors that separate the people that fall from the people that don't. And so what we'll be talking about during this session is looking at some of the things you can do to lower your risk of falling. Unfortunately, falls are the leading cause of injuries among older adults. So we have some statistics, unfortunately. 10,000 fall-related hospital admissions in 2019, 101 people at the emergency department every day in Alberta for falls, 27 people admitted every day for fall-related injuries. Unfortunately, the average length of stay is 22 days, which of course is over 3 weeks. And 95% of all hip fractures and 40% of all nursing home admissions are a direct result of falling. The other part of this too is that in 2019, it was approximately $290 million spent on seniors' fall-related hospital admissions. And so it's not only the effect of a fall on the individual and their family, but also the cost that we as Albertans all share. Could a fall change your lifestyle? So think for a moment, if you have had a fall, your friends or family or coworkers, how did you feel? Was there affecting your life? Were you able to continue to do the things? Were there other things that happened that changed what you were doing? Even if a person is not hurt, there could be consequences to a fall. They might lose their confidence in their ability to get in and out of their home. They may be afraid that they're going to fall again and stop doing things like meeting with friends, volunteering, working, or spending time with family. Unfortunately, people will, if they're not getting out, and we certainly saw a bit of this over the COVID pandemic, people can become isolated, depressed, stop exercising or eating well, and experience less independence and live in fear of falling again. The research says that moving and being physically active helps people stay independent and allows them to connect with others. And so sometimes what happens, people are afraid to fall, and so they stop doing all the things that might prevent the next fall. Sometimes people after a fall might need some gentle encouragement from trusted people to continue to look at what's the benefits of moving and being able to do it. And our whole focus of this program of Finding Balance is to help people to age in place and stay independent. We want people to live the way that they want to. There are a number of risk factors that make a person at a higher risk of falling. So we've got two of the puzzle pieces that are bigger on the screen are balance and leg strength. And we know from the research that people with better balance and stronger legs are at a lower risk of falling. But the other pieces are also potential factors, things in and around your home, your vision, medication you may be taking, other health conditions a person has, nutrition, hydration, footwear, of course, cognitive changes, depression, and dizziness. No two people fall the same way, and people fall for a variety of reasons. 70% of falls do not have a single cause. They're often very complex. Some risk factors can be changed. We can look at changing footwear, eliminating clutter, eating balanced meals. Some factors cannot be changed. We can't change our age, any medical conditions that we have, and potentially medications that we're on too. And so it's important to be able to look at what your risk factors of a fall are and be able to address some of these things. Are you at risk of falling? One of the things that one of the tools that we have, and just to tell you, all of our information on Finding Balance website, and the links will be put into the chat, are that anything on our website, they're all free. We are funded by a grant from Alberta Health, and so our materials are all free. They're things that you can order. This is one of the pieces that you can order, and it can be actually mailed right to you. So on this piece, it's called the Fall Self-Risk Assessment. There's also an online version of the Oh, am I back on, Carolyn? It just said for me to unmute.
Nope, you're good. Sorry, that was my mistake.
No problems. Okay. So I'll just go back really quick. So the first two questions, if you've fallen in the last 6 months, or if you use a cane or walker, you are at a bit of a higher risk of falling. And so there are things on this lists that you might not have thought about that make you at a higher risk of falling. For example, do you worry about falling? Are you having trouble getting up onto a curb, losing feeling in your feet, medication, sad or depressed, and vision? So it's a really fast tool, and I encourage you to share that, have a look at it, answer the questions yourself. And if you have people in your life that you're worried about, perhaps either look at the one on the website or get them to do the online one, because there are things that people can do. So when you look at the right side of the page, there's things that people can do to lower their risk of falling. Medication. The more medication a person is on, the higher their risk of falling. Taking more than 5 drugs can increase your risk of a fall by 75%, which is quite high. So just have a thought about this, if it's true or false. When you're talking to your pharmacist or doctor about your medications, should you mention taking over-the-counter items like supplements and cough syrup? The answer is true. When we talk about medications, we want to include vitamins, supplements, over-the-counter drugs such as cough syrups, cough medicines, painkillers. Because when people are talking to their healthcare provider, some of these things can interact with medication they're on, and it will help give your healthcare provider a clearer picture of what's actually happening. So it's really important that when you're talking to your pharmacist or doctor that you mention these other things you may be taking. We're very lucky in Alberta because a pharmacist can take some time to talk to you about what your medication is, and why you're taking it, possible side effects, when to take it, what happens if you miss a dose. So please talk to your pharmacist if you have when you're picking up your medications. Medications can increase the risk of falling if it makes a person sleepy, dizzy, weak, or confused, or if somebody is going to the washroom more often, and certainly at nighttime. Always review your medications with a doctor or pharmacist. Do not stop taking medications without talking to your healthcare provider. But I do encourage you to talk to your doctor or pharmacist about medications, any symptoms, and other things if you are worried about being at risk of falling. And certainly if you have new symptoms, please make sure that you talk to them so that you have the idea of they can look at, perhaps it's a medication and there may be something that they can do. These questions came from a project that we did last year with the pharmacy, a professor from the University of Alberta Pharmacy Department and a grad student that she was working with. And these are questions that they felt is very important for you to be thinking about and considering when you're talking to your doctor and also when you're talking to your pharmacist. Is this medication needed? Does it align with my goals? And is there a better option? Again, what the point of these is to help view the benefits of medication versus side effects or the risk of treatment. But please always talk to your healthcare provider or your pharmacist before changing any medication. Always follow doses and instructions. Keep a current medication list in your wallet and at home. Do not share your prescription medications. And as Ed mentioned, if you have any new symptoms such as dizziness, blurred or double vision, please talk to your healthcare provider. Something that is new that came out in 2023, some of you may have heard about, is that there's new drinking guidelines for everybody in Canada. The main message is that when it comes to drinking alcohol, less is better. As we age, our body becomes more sensitive to alcohol. Your age, your body weight, any other health conditions will impact how you respond to alcohol. Drinking alcohol has negative consequences. And binge drinking is, as the CDC said from the States, it is considered a short-term health risk for excessive drinking. They have, from the Canadian Centre on Substance Use and Addiction, they have a chart that just goes through, and this is from a lot of research that has been done worldwide, that if you are drinking 2 standard drinks or less per week, really you're at low risk or no risk. Unfortunately, as people increase their drinks per week, their risk of developing several types of cancer, including breast and colon, and anything more than 7, heart disease or stroke also increases. And so this is just something for people to be thinking about. And if you can, it's better to drink less. There haven't been, I know sometimes I get questions from people about marijuana now that it's legal. There hasn't been a lot of, because it was illegal, the studies are just coming now. And so we'll have more information as time goes on about if there are any risks to that. So typically around now, if I was seen in person with you, I would just get you to lift your hands above your head if you can, wiggle your toes just to make sure that that blood is still flowing. So how many minutes each week should older adults 65 and up be active? A 60 minutes, B 120, 150, or D 180 minutes? And the answer is 150 minutes. And this is moderate to vigorous activity per week and to prove your balance and strength. This can be broken up 30 minutes 5 times a week or 10-minute sessions a few times a day. The intent of this is activity, not just exercise. It doesn't mean that you have to be going to the gym, although that is certainly an option, but it's trying to make sure that you are moving. Sedentary behavior does unfortunately put people at a higher risk of many things. And so it's really important to be thinking about how can you keep moving in your day? What can you add in? And there's a couple of things that I'll be showing you. So this is just some of our main messages about the body and what you need to do is challenging your balance, building your strength, and being active. And as I mentioned, people who have strong legs and good sense of balance are more able to effectively and safely move in your environments. So things that you can do, challenging your balance. I know lots of times people are walkers, or pardon me, they walk for exercise and movement, which is excellent. I encourage you to add in some things that will challenge your balance and build some more strength in your legs as well. Things like yoga, Tai Chi are really great exercises to do. I know that people are going to different exercise classes or doing things online, which is terrific. Physiotherapists can also give people some good exercises to do. And so those are really important. Something that we have in Alberta, it's called Prescription to Get Active. It is if you have a doctor or healthcare provider who is part of the primary care network, PCN, they're all kind of independent, so you have to check with your doctor, but they are able to give you it's called a prescription to get active, which means there may be some opportunities for you to try out different recreation centers in and around Edmonton and in and around Alberta too, if you're not from the greater Edmonton area, to try and go to a class, see if you like it. And there's many different places who have got this agreement for prescription to get active. So it's just one more option that you can be thinking about, especially if you haven't been to a place in Edmonton that or have decided what you would like to do. Always, always, always check with your healthcare provider before you start a new program. This is one of our posters that we have. Again, our stuff is free and online. We can certainly send this out to you. On this poster are 6 different movements that we have looked at that help you to increase your balance. I try to do them every day. And the intent is that you do them every day. You're adding in this piece that will help you to stay on your feet and build your balance. They're very simple, but they're very important that you do them every day if you can. The poster is fairly large, but you can. I know my mother-in-law, she's got it on her bathroom door just to remind her to do them when she remembers. And again, you can order those from our website. We actually also have Sienna Collins from Global TV. She was very kind and was able to do that a video for us, which is on our YouTube channel. And we do have that, I believe is in the links that I sent to Carolyn and Megan. And it's a 13-minute video and it demonstrates each of the 6 movements. And there's also a harder version if these are too simple for you. You've been doing them for a while. And so she goes through each of the movements so that if you are not at an exercise class and you haven't done these kinds of things before, you can have a look at them and go, oh, okay, I get what that is. If you're doing exercise classes or activity classes, many of the people are building these kinds of exercises in already. And so, as I said, the YouTube channel, this is one of the videos. We have a number of other videos that give some information too. But thank you to Sienna Collins for being our narrator for this, and she actually demonstrates the harder version. We also have band exercises for older adults. So lots of people are using resistance bands instead of free weights. Sometimes people will use machines, but resistance bands are a great way to build strength in all parts of your body. This is a booklet that we created with pictures of older adults doing the movements. And so it is also something that you can just order for free. But I do encourage you, if you have, try them, try it in a class or with somebody that might be able to guide you through the movements in case you haven't done them before. Just a thought, the color of bands are actually different by company, not by strengths. So I know if you get a green band from one company, it may not be the same sort of strength as a different company. So just always listen to your body when you're doing any of these movements. The other thing with resistance bands, you also have to think about your grip strength because they do rely on making sure that you can grip them and so that you don't snap those bands. But they are a good way of working on some of the strength and balance. All the benefits of being active. It can improve your mood, concentration. It can reduce stress and anxiety, improve your sleep. It keeps your lungs, heart, muscles, and bones strong, helps keep us at a healthier weight with a good appetite. It keeps our bowels healthy. It reduces the risk of other health conditions, and it can improve our balance, which is very important. Something else that we have added this year to our information is we have some information on nutrition and hydration. It has come through some registered dietitians from Alberta Health Services, and they've got some great information. The Canada Food Guide has been updated, and it's got some really good information about what it is it means to have a healthy plate and make sure that you're drinking 6 to 8 glasses of water per day. So that's some information that I just wanted to mention that I don't have a slide for, so just to kind of keep that in mind. All right, one of the other factors is vision. Did you know that 1 in 9 Canadians will develop irreversible vision loss by age 65? And 1 in 4 Canadians develop irreversible vision loss by age 75. And this is according to the Alberta Association of Optometrists. Many eye diseases have no early signs or symptoms. So what will happen is that when you go to see an optometrist, they're going to be looking for eye diseases such as cataracts, glaucoma, macular degeneration, a tear in the retina, bleeding, tumors, and early signs of serious medical conditions such as high blood pressure, diabetes, and cardiovascular disease. And as I mentioned, or as the slide says, many eye diseases have no signs or symptoms, so it's the eye exam that can identify the risk. Alberta health coverage is available towards the annual eye exam for Albertans 65 years and older. And so what I encourage is find an optometrist nearby. We're lucky being in the city, and get your eyes checked every year. It's not just to look for the prescription eyewear glasses to just make sure that my prescription is correct, but it's also looking at eye health. Now, with something that one of the questions we've had recently is about the Alberta health coverage towards the eye exam. We had some questions about the eye exam and the additional tests. because some of the additional tests are not covered in the same way. So just be aware of that, and always ask if you're not sure of what is going to be covered by Alberta Health or what you may be needing to pay. Always ask up front, and the optometrist should be very willing to tell you what is covered and what may not be covered. And we're going to be having more information. We just had talked with the Alberta Optometrist Association to get some more information so that we can put that on our website so people have an idea of what's happening. So in your home and community, as we know, falls can happen anywhere in the community when you're doing recreation, leisure, sport, work, on vacation. So in the bathroom, safety grab bars are required, or you could have, and this is to help you age in place, by the shower, tub, and toilet. The grab bars need to be installed properly, and they are not towel racks. So if you are going to put grab bars in your home, please make sure that they're actually the safety grab bars and that they're not towel racks. Towel racks won't take your weight, and they also need to be installed properly. Have your toilet paper and other items within your reach. Very important, non-slip mats inside and outside the bathtub and the shower. Keep your floors dry as much as you can, and have a night light on in the bathroom. People could be rushing to the washroom in the middle of the night, and it's important to be able to have, especially when we're partly asleep or rushing, that light is going to guide us into where we need to go. On the stairs is another area that people will often fall. Handrails on both sides. If you can, make sure the light's on. And if you have that opportunity to have the light switches at the top and bottom of the stairs, they're free of clutter. And also, if you can keep your hands without things hanging onto. I know two people I know talked about a grandparent who had fallen. They were taking their laundry down to their basement, and they started to go and they weren't able to grab the handrail to help them get back. So I have some pictures, and we'll just spend a few minutes on them. And I'm not sure if people can unmute or not, but this is just a picture of a living room. We've added a bunch of fall risks to it. Now, most likely people's rooms don't look like this, but it's kind of, the intent is to give people an idea of what is going on. And so it's kind of fun to see. So I don't know if anybody can unmute or not, but people are drawing pictures on there. Cool. So it's kind of a fun thing. So the cord, the mat, the newspapers, the clutter on the ground, the vacuum's in the way, the walker's in the way. The mat is certainly not a non-slip mat. And if you look at that back chair, it's actually a rolly chair. So I encourage you not to use a rolling chair there. If you don't sit on them correctly, try to have really stable furnishings, and also that you are able to get to all of your light switches. So this is just the same room. Oh, I don't know where those orange things went. Okay. So they are, here's the room which have taken out the falls hazards so that we can actually have a look at the pathways are clear, the cords are behind, you can get to the lights, you can get to the phone. The phone cord was another one in the way, just to make sure that you've got some sections. Oh, I don't know who or how those orange things went on. If somebody wants to take those off, that'd be great. I don't know how that is. We'll just keep going. So in the foyer, again, thank you. The mat is in the way, the dog leash, that blue thing is actually a puddle. And so when you come in and out of the door, it's really important to have something like this. There's a non-slip mat in front of the door. All of the dog things have been put away. The water has been cleaned up, and the boots and everything else has been put away. In the bathroom, you can see the clutter. The walker is not in the right position, so that if somebody was going to be on the toilet or getting in and out of the bathtub, it needs to be in a different spot. Again, there's clutter, towels in the way, water, and the mat. So, and also there are no grab bars. So I just want to go to the next one just to show you some of the things that you can see. Here are the grab bars. Now in this picture, we actually used a room in the university to get these pictures. We had a photographer come in and do these for us. So the grab bar on the back of the toilet is kind of in an odd spot. There is another one that could be beside that. Sometimes people have raised toilets, and that can also give them the help to come up and off the toilet. Encourage you to talk with an occupational therapist. They are, you can actually access them through home care. They are free of charge. Unfortunately, there may be a waiting list, but they can come into your home and have a look, and maybe your couch is a little bit low, or maybe your seat would, if you could raise your seat, it might be a bit easier for you to stay in the home. Also, if you can see, there's a bath mat in the tub. There's a good bath mat outside of the tub, and the grab bars on the sides are there for people coming in and out of the tub. The shampoo is where you need it. It's not like where you have to reach outside of the tub, and the towel's been put away too. This is a bedroom. And so same thing, lots of clutter, the pathway in and out of the bed, because they would be coming in off this side, the cord's in the way, the mat, the laundry's in the way. You can see the purse handles are also a trip hazard. And even the things that are on the bedside table, is try to think about what's on your bedside table at night. And the items that you really need is what you should have there. I mean, the plant is beautiful, but there might be a different space so that you've got, if it's your glasses or your pills or your book or your phone. So those are the things, so that in the middle of the night, you're not going to have to be reaching for things or having to get up unless you are for other reasons. So there's what we've kind of done. Everything's been put away. There's the phone, the glasses, something else. The cords are out of the way. And now this person can get in and out of the bed easily. There's also a bed rail. That is another piece of equipment that an occupational therapist might be able to help you with. And that can help people get in and out of the bed as well. Stairs. So there's clutter on the stairs. Certainly that is one of the biggest things in this picture. And I'm just going to go to the picture that has been eliminated the hazards. So when we're looking at it, it's got the handrail at the side, the lights on, of course, all the clutter have been removed. And something to consider, especially if your stairs, going to a basement that might be slippery, is that you might want to have a non-slip mat at the bottom or top of the stairs. Also, if you have a slippery mat, please consider removing a slippery mat that is at the top or the bottom of the stairs, because of course you're coming off and on stairs. And so when your weight's on that mat, you just want to make sure that there's no slippage when you do that. So just to kind of go through it again for the trip hazards in your home, always keep your pathways clear and eliminate clutter. It's really important. I know that there was a gal who had, it was her ironing board that was in the way, and she fell over the edge of it. Like she tripped on the stand of it. Always have non-slip mats. Consider getting rid of the mats or having a non-slip option. Keep a phone and other things nearby you when you need them. Some people don't like having night lights on because especially at nighttime, it distracts them. So there are motion sensors that you can get that you can kind of change the focus of them so that you actually have to be moving before they come on, so that it's dark in the nighttime. But those can certainly go bathrooms, hallways. And the other thing to think about is your mobility aids. If you're using a walker or a cane, please make sure they're in good condition and that that they are fitted to you correctly. Because I know my dad, he had used, when he needed a walker, he was actually using his mothers. And of course, she was like, 5'2", and my dad was almost 6 feet. So we needed to make sure that we got that fitted correctly to him, and because he wondered why his back was getting sore because he was leaned over trying to use the walker. So please make sure that you do that. Occupational therapists, physiotherapists can certainly help you do that. So footwear and foot care. The main point is that your feet that are healthy and pain-free can help you keep your balance. So it's really important, if you have a change in your feet are getting numb or tingling, please consider talking to your healthcare provider to see if there's something that they could potentially help you with. And always wear supportive, non-slip footwear, both inside and outside of your house. Something to keep in mind, footwear should have a non-slip tread. If you're wearing pressure stockings, they can be very, very slippery on laminate, hardwood, and carpet. And certainly we don't want you to slip because of that. High heels, slip-on sandals that don't have a back, untied laces. Crocs are very comfortable, but they don't have a lot of support because your feet can move in front of them, and also your foot can come off the back of them. So it's not giving you a very good base to be walking on. So what we want you to have is support, some kind of a back, and that will allow your foot to be stabilized inside of your shoe. We have a picture of an ideal shoe. And again, it's not the most attractive of shoes. Luckily that there's far more options now for shoes that are a little bit nicer, but it has the basic information on here. Laces or Velcro that you can tighten up or loosen if your feet swell as the day goes on. There's the back heel cup that makes sure that it won't slip off when you move your feet or when you're going up and down stairs. You have enough room for your toes, the stability, you have a good sole, the heel's not too high, it's nice and wide and flat, and that it's got enough grip on it. Very, very important. Winter walking, and of course, we're not quite there yet, but we're certainly on our way, unfortunately. I mean, yay, Edmonton. So I've kind of talked about the footwear for winter. So something to think about in winter is making sure that whatever you're wearing has the proper amount of grip. People can try the ice grips that fit over footwear. I know there's ones with spikes. There's some with coils. You have to try them. Some people don't like them. It changes the way they walk. You cannot wear them inside because they will wreck the floors, and also they will also have they can be very slippery as well. So what you want is soles that stay flexible in the cold and a wide flat heel. If you can, avoid walking on snow and ice. It's kind of almost impossible, I know, especially depending on whether people are shoveling or not. 311 may be an option if people are not shoveling. If you're using a cane, try a retractable ice pick, because that is something that you can actually move up and down so that you're going inside. So you've got this ice pick when you're in the snow and ice, but when you come inside, you can just flip it up, and you get those at all kinds of drugstores and that kind of thing. People can also carry a small bag or container of sand, especially when you can't avoid some of those icy spots, that black ice. Also in a parking lot, I have some in my car so that when I'm coming out of my vehicle, I can, it looks a little bit slippery, I can put some sand down. People have used kitty litter. I haven't used it, but it's kind of, what it is trying to be thinking of things that's going to keep you on your feet during the winter. Also, try to keep your hands free for gripping handrails or supports. So, have a backpack or a bag that you can have over your shoulder. This is a piece from the AHS, and it's a really nice thing. It's on our website and also on the AHS website, and it's a penguin walk. And of course, penguins are awesome because they don't fall on the thing. And so what they do is you can just follow the the instructions, you bend slightly and walk flat-footed, point your feet out, keep your center of gravity over your feet, watch where you're stepping, take shorter shuffle-like steps. I find even sometimes the sidewalks are fine, but sometimes the road's really slippery. So keeping your arms at your sides, but not in your pockets, and taking those lovely shuffle-like steps will hopefully get you past that ice. Concentrate on keeping your balance and going slowly if you can. So hopefully that will work. Now, unfortunately, there is that time that people may fall. And so something that we suggest that people be thinking about is kind of preparing if you fall, plan what you could do and practice what to do. If somebody is hurt, call 911. Try not to help people up because you don't want to pull them up. You may get hurt or you may hurt that person more. So this piece of information is only if the person is not injured. We also have this in 15 different languages. If somebody's first language is not English, it comes in 15 different languages, and that it goes through the explanation's not on this slide, but certainly on the piece that you can download, or it's in the booklet. And so basically what happens, if somebody has a fall, they kind of wait. If they're okay, not injured, then they can scooch over to a stable chair, not a rolling chair, or a bed or couch, and then put one knee up or one foot up, whichever is the better leg or better knee, and then put your hands on the chair and then kind of scooch your rear end, and then you can turn around and sit. And so it's just one of those thoughts of what can you do when you've got when somebody has fallen. And another option, if people are walking outside, it's a little bit more difficult, but there are ways to do it. And certainly, if you can have a phone nearby, that would be great. We have a number of resources. As I said, all of our resources are free from the Finding Balance website. The ones that you can order that will be actually mailed to you, the Keeping Well for Older Adult booklet. So this booklet, we just reviewed it. I don't know if any of you have seen it, but we've just updated a little bit. It's 32 pages, and it goes through a wide variety of things. It has exercises to do, some of the pieces that I've shown you. It has a word search. It has things on how to protect yourself from frauds and scams. It has helpful websites, helpful phone numbers, some nutrition, fire safety, and the intent of that is for people to be looking and keeping well quality of life as much as we can. And those are just at the printer right now. So I know people have pre-ordered them, but certainly it's something that you can be looking at. The brochure, posters, the self-assessment checklist that I mentioned, and the resistance band booklet. Everything else is downloadable from our catalog. And that means you can phone or go on our website. We can certainly do it either way. One more thing I just want to tell people, on our website, we have a number of webinars coming up. We have a nutrition webinar by AHS staff who are going to be talking about nutrition and hydration. We have a practitioner's day that's talking about some of the research, but you're certainly able to join or interested in join us. And those are all on the website, and it's through Zoom, which is the same format as this. So I believe that Carolyn is going to be doing this question as well in the follow-up survey, but one change that you will make to lower your risk of falling. I've covered a lot of different things. Many falls are preventable. There are things that you can do to lower your risk of falling. It doesn't matter what your abilities are today, you can improve your strength and balance. If you can, identify and then address some of the risk factors that you have. And if you have had a fall, please tell your healthcare provider. The intent is that if you've had a fall is to figure out what might have happened and how you can reduce your risk of falling again. So questions? And I'm just going to stop sharing. I'm just going to go to the last one. There's our information. And I believe that Carolyn and Megan are going to be putting the contact information in there. Megan, I don't believe I put the phone number in there, but they can certainly phone as well. So the phone number is 780-492-6019. Many of us at the Injury Prevention Center work part-time, so please leave a message and we will get back to you. Okay, I'm just going to stop sharing my screen, start my video, and if there's any questions.
Wonderful. Thank you so much, Melanie. That was an excellent presentation, and I think everybody needs to see this. And what I loved about your presentation was the practical suggestions that you made, very practical, lots of resources. So wonderful. Thank you for taking the time to be with us today. So if you're thinking of questions, we'll get an opportunity to go around and you can put your hand up. But I do have a couple of questions in the chat. I'll just start with, I think Jacobo has a couple of questions, and I'll just read them to you.
Yeah.
The first one, how beneficial would it be to have an exercise strengthening plan to follow for fall prevention for members in long-term care or group home? Is there one that would be recommended?
That's a big question. I know that our resources are used in long-term care. The thing with long-term care is that there are so many factors that have to be addressed within long-term care. And I don't have one single exercise program that I would recommend, because certainly in long-term care, there may be people with cognitive issues or dementia, which puts them at a higher risk of falling. There may be things that they need to do. Most places like long-term care and other lodges and other residences have either a fall risk protocol, or if somebody has had a fall, they should have some kind of a policy in place to help support people. Sometimes there's frequent fallers, and so sometimes it can be very, very complicated to figure out what is happening. And I know I had somebody tell me it was like being a detective sometimes when somebody keeps falling in a place, because it's like, well, what is it that's happening? And so I don't have one program specifically, but I would certainly encourage them. A lot of them have recreational therapists involved, and to talk to the staff in there as well to see what they're going to be doing to address those needs, because everybody can benefit. I had one gal, she did every morning, a physiotherapist had started her day with doing exercises every morning in her bed. Before she was fairly mobile, but every morning this is what she did. And a physiotherapist had told her. And so I would just suggest that they check with the facility themselves and see what might be offered.
Great, thanks very much, Melanie. Excellent suggestions. Just another question here in the chat. Is there a type of footwear recommended for someone that has to get up often at night?
If you are, so it depends on how fast you're trying to get. I'm expecting it's because they're rushing to the bathroom. So it depends if they have enough time to get up, put slippers on, and get to the bathroom. Again, have a night light or a motion sensor, so you have light going in and out of the bathroom. Make sure that you have a non-slip mat beside your bed. Your pathway is clear, that you are able to get to the bathroom safely and back. And with footwear, if you're looking at a slipper, make sure it's got a good grip. It's got a back on it, so it's not going to, if you're putting your foot in, you're going to put your foot right in and have that back come up so that your foot is snugly in there. And so that would be my suggestion, is a night light, make sure your path is clear, and then look at that footwear, like I had mentioned with that ideal shoe.
Great, thank you, Melanie. We have some great questions here. Got a couple more here for you. Any suggestions on how to deal with uneven pavement on sidewalks? We don't have uneven pavement here in Edmonton.
If you are using a mobility device, continue to use that on the sidewalk. If you have a cane or a walker, please make sure that you're using your cane and walker wherever you're going. Take your time. I think sometimes what happens as we age, we think we're as fast out and steady as we might have been earlier when we were a bit younger. So certainly with uneven pavement, take your time. Make sure that you are wearing good footwear, that you have your hands free. If there's railings available, which I know there aren't on lots of sidewalks, but if there's railings available, please make sure you use them. And I would suggest that if it's really a problem, is to contact, I'm saying 311, but there may be a better number to phone for the city. Because if it's an issue lots of people fall because the sidewalks are not great. So hopefully that answers the question, but take your time, really be watching to make sure that you're seeing what is down there. And if it's nighttime, if you have a phone, you can always put your flashlight on so that you can see what's going on there. Use the hand railings, keep your hands free. And yeah, it is an issue here.
Great answer. And I think 311 indeed is probably the best first step. If you have things for the city to address, or if you don't get answers from 311, find out who your city councilor is and give a call to his or her office. Yeah, the other question I have in the chat, another great question. Do you have any tips for preventing people who are walking from rolling their ankles? I think I've done that before.
Sorry, I need that.
Yes.
I would suggest that they really have a look at the type of footwear they're using. Because if you have, more like a hiking boot that's a little bit higher potentially on the ankle, it might, and it has a, some footwear is really narrow. So you may need to make sure that you're looking at, you've got a wide enough base and that your laces are tight and that your footwear might be a little bit higher on your ankle. Again, this is all personal comfort. Take your time, because there are uneven sidewalks coming off and on curbs. And I would check potentially with a physiotherapist. They may have some other ideas of how to actually strengthen your ankles. There are specific exercises that people can do that target their ankles to help build up that strength, so that if you have a bit of a wobble, you're not going to go over, that you've built up that strength. So I would look into that potentially too.
Great. Thank you very much, Melanie. And actually, I have a quick question for you while people are thinking up additional questions. The band exercise booklet, I've seen it around, and I'm wondering if it's in different languages.
No.
No, it's not. Any plans for it to be?
Well, we would love to do multiple languages. And that's a really good question. It is something that we have looked at. Unfortunately, we are not for profit, but what I would suggest, Carolyn, if you are having requests for it in a certain language, that might be something, send me the email, or anybody else on this call can phone or send me an email and say, we would really have this group of people that would really like this in another language. Because then I know we've done some a project with some Alberta Health Services people who are doing a different program, and they have translated some of our other resources into different, are translating some of our different resources into the top languages in Alberta. Because of course, English and French, and then there's a number of other languages that are, that many people in Alberta, that's their first language. So yeah, I think if there's something that you have in mind, Carolyn, or somebody else on the call, please email me and we can see if we can do it. The flip side of that is, if anybody knows of people who are translators and can do it at a less cost for us, that would be, potentially something else we would look at, because we're certainly willing to have that done.
Okay, perfect. Thanks very much. That's excellent. We may have a conversation about that. I've done a little bit of research in terms of translating some of our materials in the past, so we might be
Oh,
able to come up with a
okay.
plan.
Super, thank you.
Yeah, so that's wonderful. Do I see any more hands? We do have a couple of more minutes if there are any other questions that you have for Melanie. Okay, I do see one more question. Okay, I'm not sure how to pronounce your name. Is it Quinn? Where and how can I fund it or find it? What are you referring to, Quinn? You can unmute and maybe ask the question. It's spelled ZQUIN, so I'm assuming the Z is silent. Quinn? Oh, the band manual. Oh, where she can find the band manual or the band booklet that we had just talked about?
Sure. I'm actually going to just, if I can share my screen one more time, Carolyn, I'll just show people our website and just give you a quick tour. Is it sharing the website?
Yeah, it sure is.
Okay. So this is the Finding Balance website in the links that that will be shared with you. So what you can do, there's a couple of ways to visit the catalog. There's our videos. You can also just go to resources at the top, resource catalog. And that will take you to this page. And we have a lot of resources that you can order. Each one of these has a bunch of different ones underneath it. And if you would like to, I'm just going to go back up, resources to order resources. And these are the ones that actually, there are these ones that are available to be ordered. And all you would do is you would just click on the order now. You can phone us as well if you want, but because you're using a computer, you can certainly just do this. Name, information, we will actually email it directly to you. And with the booklet, as I said, it's a pre-order, so nothing is going out because it's at the printers at this moment. The booklet that we were talking about, you can get 10, 25, or 50. But if you only want one, that is fine too. There should be a spot on here for resources for order. Yeah, you can add some information or you can just call us and we can send out one or two if you're interested. So that's just a quick tour of it. Also, sorry, on there, if you're looking at the webinars, you can register from there as well. Those are all linked on our resources page, as well as we do have a newsletter that goes out 5 times a year, and it has a lot of different resources, links to different information, new research, programs that are going on in the province. And it's again free. I think at this point there's 1,700 people on our distribution list. Some of those are big organizations that are getting it. So certainly if you're interested, you can always unsubscribe if it's something that you don't want, but it has a lot of information about what you could be looking at, any of the new things coming out, and also potential learning opportunities if you're interested in those as well.
Perfect. One last question for me. Are the resources on your website printable? You might have said it and I might have.
Online? Yes. Everything on our website can be downloaded, and you can download it and print it off, whatever you would like.
Okay,
so
perfect.
Definitely, yeah. And if there's something I always ask to, if there's something that you have an issue or a question about and you don't see our resources addressing that issue, please consider emailing or calling us. This is what's happened in the past and we've got, oh yeah, this is an issue. Why don't you have something on this? Then it's something we may be able to look at and address as well. So just keep that in mind too.
Excellent. Thank you so much. I think I don't see any more questions in the chat, and we are actually coming up to about 1 o'clock. We have about a minute left, and thank you very much, Melanie. Our next Lunch and Learn will be in December. There will be no Lunch and Learn scheduled for the month of November. And so if you subscribe to ESCC's link letter, you can find out about our next Lunch and Learn or on our ESCC website. or on social media. And actually, if you go to our website at seniorscouncil.net, Lunch and Learns, we have all of our updated Lunch and Learns and information on our website. I'd like to promote a couple of other offerings that we have over the next month or so. The one that we have coming up is emergency preparedness. We have to be prepared for just about anything these days. E-Prep for short is a 2-hour in-person workshop where participants will create their own personalized emergency preparedness plan. So if you're interested in participating, we have 2 separate sessions that you can choose from. October 31st from 1 to 3:30, that will be held in person at the Edmonton Seniors Coordinating Council office at Bonnie Doon. Or you can choose to attend November 1st from 9 to 11:30. That session will be held at West End Seniors Activity Center, and I'll have, I think Megan has put the link in there for further information and for registration. Also, we have another event coming up, Age Friendly Edmonton and Southeast Edmonton Seniors Association. We're going to bring the geriachters to you in live performance. If you don't know, the Geriactors are an intergenerational theater group that brings together seniors and university students to create original plays based on true stories and around issues of aging. So they've got 2 plays that they're going to perform. It'll take about an hour. We have free refreshments and an opportunity to discuss the plays and to share stories. And again, this is November 2nd. From 2 to 3:30 p.m. at Southeast Edmonton Seniors Association. And I think Megan has put the link in the chat. So we hope to see you there. And just to wind up our session today, thank you all for coming today, and hope you learned lots from Melanie's presentation. I certainly did. If you have any questions, you can also email me at agefriendlyedmonton@seniorscouncil.net, or directly to Melanie is perfectly fine. I will also send out a short survey about this event, and we would appreciate any feedback that you have on our Lunch and Learns and on this one in particular. So thanks again, and thank you for coming, and have a great day.
Thank you, everybody.
Thank you.